Hello, welcome to Grade.com Talks List. Today, we're talking with Deborah Matityaho, Executive Director and co-founder of Beyond Fistula, a nonprofit organization that helps obstetric fistula survivors heal and rebuild their lives after surgery through counseling, vocational training, and scholarships. And if you're new to our podcast, please press subscribe button on your podcast app or on YouTube, because today we're going to learn about organization that is helping to improve the lives of fistula survivors. Hello, Deborah.
How are you,
Welcome,
Kareem?
welcome to Grade.com Talks. We're excited to have you here.
Well, thank you. I'm really honored to be here. So thank you for inviting me.
Thank you so much. How would you describe Beyond Fistula for someone who is not familiar with your work?
So Beyond Fistula is a relatively small organization. We're based in the United States because I run it through the United States, and the work is all done in Western Kenya, so Eldoret, Kenya. So what we do is we take care of women and girls who have had what we consider childbirth injuries, so severe injuries in the pelvic area where it's typically a result of a prolonged and difficult childbirth. And a lot of these women don't go to the hospital to deliver their babies. They have really long, protracted childbirth at home. And the result is they end up often losing their baby and doing a fair amount of damage to their internal organs. And so the result is, most of the time, like I had mentioned, they lose the baby and they end up with uncontrolled leakage of urine and sometimes feces. And so it's a devastating condition. It's devastating in so many different levels. And in addition, their their family and community usually shuns them because they feel like these women were cursed. And so we find these women, we work with a surgeon that helps to repair these women. And then we do the next steps, that we do the steps beyond fistula repair, which is the step of getting them back on their feet so that they're not just being repaired, but they're being healed spiritually and emotionally. And also we give them the means to have some financial, some ability to earn money and stand on their own 2 feet. So they're not what I call economic hostages of their family or spouse.
Mm-hmm. So, some of the stories that you indicated, they're very sad, and the fact that you are addressing those issues and helping those young girls and women overcome them is worth acknowledging. So thank you for your work. How spread is this illness or fistula in Western Kenya, and what are the main causes of it?
So that's a great question. It's one of those hidden diseases, so we don't really know the full extent. We say that obstetric fistula is a condition in areas where there's limited to no maternal health care and where women's health care is not valued. And so it's pretty widespread in many areas in the developing world where health care is not available to women or to others. Every single article that you read, it says there's about 3 million women with obstetric fistula worldwide. But we don't really know because we don't know until we find them. And most women stay silent and stay hidden because they're embarrassed. The fistula surgeon that I work with probably does about 500 fistula surgeries a year. And he's not the only one in Western Kenya. There's others, and there's limited number of fistula surgeons, and there's probably many more fistulas that are out there that we don't know about.
Mm-hmm. Wow. 3 million all over the world. It seems like a very huge number. And you mentioned that we might not know fully the extent of its spreadness, so it's even scarier. How is governments or medical institutions are taking actions towards helping young and girls and women who are going through this procedure in Kenya?
Great question. You have really good questions. I don't know that the government is actually doing that much. Most of the care for women who have obstetric fistula is done through different nonprofit organizations. So the surgeries are not really covered or taken care of by the government, not at least not in Kenya. I'll tell you about a couple of different organizations that are doing great work and funding surgeries and doing outreach to find these women. But the government itself is not doing much. There is a national health insurance through the Kenyan government. However, a lot of people are not on it. I think there's a lot of mistrust, there's a lot of corruption, and people don't really buy into it. So most everyone that we take care of has zero health insurance, zero coverage, and really the surgeries are all covered by different nonprofit organizations that feel strongly about helping women.
Mm-hmm. Wow, that's very unfortunate that the government is not supporting those women and young girls. However, organizations like yours are there to support, and which is very noble. Can you tell us how did you come up with the idea of forming your nonprofit organization? Is there a personal story behind addressing the fistula?
So probably most people that you've interviewed, we all have a personal story that landed us where we are. So I'm an OBGYN physician. So I'm a women's health physician, and I work in Northern California. And about 11 years ago now, my husband and I had an opportunity to travel. My husband is an orthopedic trauma surgeon, and he was offered a number of different training fellowships and research fellowships. And we strung together a whole bunch of them and decided to uproot ourselves and travel around the world for 10 months. And we took our kids with us. They were 8 and 10 at the time. And we, traveled through Europe. We went to Israel for a few months. And then we had reached out to a number of different physicians to see, would you be interested in having us come and join you? Do you have use for us? And there just happened to be a physician, an orthopedic surgeon in Eldoret, Kenya, Western Kenya, that responded and said, yes, we would love to have you. And my husband said, well, great. Is there a gynecologic surgeon that my wife could work with? And I just happened to be connected to Dr. Hilary Mabea, who's the fistula surgeon that I'm still working with today. So we spent a month in Western Kenya. My husband worked in the orthopedic department. I worked with Dr. Mabea. I assisted on surgery. I was really, really taken with the stories. The nurses and the nursing students in the emergency room said, what do you guys do for fistula surgery in the United States? And I said, well, we don't really have this issue in the United States, because for us, prolonged labor is 3 hours of pushing and then somebody gets a C-section. Here, prolonged labor is 5 days of pushing in your hut, and then you have to find a way to get to the hospital. And by then, there's some, severe consequences. And so they were shocked that we don't have fistula. I was shocked at how most of these women have worse healthcare than my dog gets. And it was really sad to me. And so I found a woman in the hospital who spoke English and Swahili, and I asked her if she would help me out and allow me to use her, her translation skills to help me interview some of the women after surgery. And so I started interviewing woman after woman to get their stories. And most stories are the same. I had forced intercourse, or I was sold young as a bride. I got pregnant. I pushed for days. Everyone kept saying, keep pushing, keep pushing. I didn't feel the baby move. They said, keep pushing. And then I passed out and I woke up. I was in the hospital. My baby was gone. I went home and I was leaking. And then everyone thought I was cursed and kicked me out of the house. And I had to drop out of school. I mean, in different permutations, that was pretty much the same story for every woman, to the point where my oldest child, who was 10 at the time, was like, Mom, why do you keep interviewing these women? It's the same story. What are you learning? And I said, well, just the fact that every single woman has this horrendous, utterly horrendous story. And after a few interviews, even you as a 10-year-old are already sort of immune to the horrific tragedy of these stories, tells me that we need to do something. And I've never been sort of somebody that's an activist or promotes other causes, or at least not at that point. And I left there feeling like I have the ability to be their voice and share their stories with the world, where they don't have that access or ability. And so when we left Kenya, I thought a lot about what could we do? Like, I can't pretend that I wasn't there and I wasn't witness to these, utterly devastating stories. Like, what can I do? And so I worked with the doctor's wife, and the woman that I ran into in the hospital that helped me translate, I put her through school to be a social worker, and she's part of our organization. So between those two women, Carol and Lena, we talked and we said, what can we do? And we started with just me sending some money and sending the women that I interviewed back to school. And then over time, they said, we could do so much more. Can we please, have you start a nonprofit and raise money? And of course, initially I said, I have a day job. Like, I'm not someone that's going to start a nonprofit. I have no idea what I would do with a nonprofit. And my oldest at the time said, what, Mom? Now it's like 2 years later. And my oldest was like, Mom, I'm going to have a bat mitzvah soon. We can raise money at the bat mitzvah. I'll make a website. Let's just try it. And so I thought it was going to be a 1 or 2 year event of just, let's see what we do with this. And now here we are 10 years later, and the organization keeps growing and growing. And so I've grown into the role, and the local team has grown into the role. And, it's one of those stories where it just, I saw something, I felt something, and I felt like I couldn't live with myself if I didn't try to do something.
I can hear the emotions that is coming through your voice. It seems like those stories really touched you upon, and that led you to changing the lives of the young doctor that you were working with, that you put her through the school. And now I think I imagine the numbers are in 3 or 4 digits, that you're helping many young women across the Kenya. I applaud you for your cause and for your bravery. That's wonderful.
Well, thank you.
So you mentioned that you guys provide vocational training, and on your website I saw that you also provide scholarships and programs. Could you please briefly tell us about 3 those things that you're working on and how they're impacting the lives of young girls and women who are enrolled?
Absolutely. So we have a couple of different programs. I look at us as a startup still, even though it's 10 years in, because we try different programs. And as you know, it's not always easy to say what's going to work and what's not going to work. From, using my first world lens to help people in the developing world, it doesn't always work. So as a side, just, my philosophy is, I meet with my local team and we sort of talk about a vision and what we think will work and what we think will be helpful. And then they institute all of the programs. So I don't micromanage anything. I really let the local team decide what works best. And these are a lot of the programs that they came up with. So our initial program that we started with was school scholarships. So getting some of the younger girls back into primary and secondary school. And so we give them full scholarships. So it ends up between like $500 to $800 for a year to pay for like tuition, sometimes room and board, exam fees, food, everything. So we have about 10 young students right now in school. Some of them live in our program house, some of them are in boarding school, some of them are going to school from their own village at home. And so we're committed to those students until they graduate. So it's a smaller program because it's a really long-term commitment. And that program it's a tough one because a lot of these girls have not been in school for a while, have depression, have social anxiety, have really, after being stigmatized with having a fistula, have a really hard time being back in school. Some of them are still leaking a little bit, even after surgery, because some of them need multiple surgeries to be dry. So that's one of our programs. And we actually have connected, we connect with a lot of other organizations, like crowdsource funding organizations, to help us. And so for the school students, we're connected with the school fund. And that helps us raise funds to keep all the students in school. So that's our school program and school scholarship. The second program that we started from the beginning was we call it the intensive or deep dive vocational training program. So this is a program where we have anywhere between 10 and 15 women in this program. They all live in our program house. So we feed them, we house them, we, do a lot of emotional and social support. And we send them to a local vocational training college, and they get to choose what they want to train in. Most of them are all training in tailoring, hairdressing, or catering. And so that's a lot for that. For those programs, a lot of it is a year and a half long program. And then afterwards, the school helps them get an apprenticeship. And afterwards, we also support them and help them get a business grant. Mm-hmm. The third program that we had just started in the last 2 years were 3-day intensive training seminars. So we grab about 40 women that most of them are older women. They have families. They can't afford to be in our program for a year long, but we bring them in for 3 days and do an intensive business skills training seminar to teach them, how do you budget? How do you save money? How do you say no to your family members when they notice that you have a few dollars and they want your money? How do you negotiate and say, well, I want to reinvest my money back in my business so that I can grow the business so that we eventually can have more money. So there's a lot of local learnings, besides what we would think of as business learning. So we do a 3-day business skills seminar, and afterwards send them home with food. And then once they pitch an idea to us, a business grant. And in addition, we do a 3-day farm skills seminar where we have another organization called Farming God's Way that comes in and teaches the women sustainable farming using like chop and drop, and how to avoid erosion, and how to plant your seeds, and how to have better yield without having to buy a ton of fertilizer or having to buy your own seeds, and et cetera. And then again, after those seminars, we give them a business grant. And so that's been really successful, although on hold because of COVID. And then we also because of COVID, we started doing a lot more business grants for women. And so we've partnered up with 2 other crowdsource funding websites, which they're always super helpful for us because it expands our donor base. So we have Benevolent, which is one where you just post a need and people donate. And the other is Donor C, where you post a need, but through a video ask, and people donate. And so we've just been really focusing on having doing outreach to women and figuring out what do you need and what can we help you with. And also we're working on more intensive follow-up. So those are our big programs. And then in addition, because of COVID, we had since we weren't having all those seminars, local seminars, we started doing a research project with the help of a researcher at UCSF. And we're doing a retrospective study to see what is the financial, social, and emotional impact of our program on these women. And so because we've got researchers going out and interviewing a lot of women, we're also using those researchers as follow-up for the business grants that we're giving out.
That's wonderful.
We got a lot of things going on at once.
Yeah, that's incredible. The fact that you're not only addressing one age group, but you're addressing young girls, you're addressing adults, and you're also addressing the women who are in their path of who have already built families, and they want to enter the job market through either training, or they want to open their own businesses. The fact that you are supporting them all, and not only with education, but also with grants and business grants when needed, it's incredible. How do you see the issue of fistula and your organization addressing it and solving it in the next 10 years?
So I don't see our organization solving the issue.
Addressing.
We're addressing, but certainly not solving. Um, that's a tough one, because fistula really happens in areas where women have no access to healthcare and are usually isolated. Most of these women are in remote villages. So, the best we can do and what we're really working on is, number one, education. So anytime we have women that are coming into our program, we really work hard at educating them and helping them understand this is a medical condition. This happened because of prolonged labor. This did not happen because you were cursed. This did not happen because you're a bad person. And also educating their family to let them know this is what is going on. This is what the woman is going through. These are the causes of this. This was not witchcraft. This was not some unknown mystery. This is just a medical condition. And we feel like the more we educate the families and the men in the village, the better these women are. I could tell you that we work closely with other organizations that do a lot of outreach and a lot of education and a lot of, radio programs saying, like, if you know somebody that leaks, send them to us, and in addition, after we work with these women, we, repair them, et cetera, like we make sure that we try and get them enrolled in the national health insurance. And we tell them that if you get pregnant again, you have to come back. You have to come to the hospital. You have to let us take care of you. Like, we will do a C-section. We will try and do everything we can to prevent a future injury like this, and let them know they're very susceptible to having this happen again if they have another birth. So, it's really just a ton of education of the patient, the family, and then, the community.
You're absolutely right. Always the first step is acknowledging that there is this issue, and then educating people that this issue exists, and it's more of it's a health condition rather than superstitions that people used to believe. And for our viewers who would like to support your organization, how can they do that?
So in so many ways, we have different ways that you can donate, and we try and have it so that there's a lot of different options so that you can feel really good about what you're doing. On our website, beyondfistula.org, there's a donate button, and on our website there's also links to the benevolent website so that you can actually see individual women and exactly what they're looking to be supported in, and what business grant they're asking for. And again, on our website, on the donate page, there's the donor C link, and so you can click and see like a video of this woman of a different woman telling you, or someone else helping her tell in English what her need is. And then there's a link for the school fund if you want to look at like the school children that we're taking care of, and you can donate to a specific child that needs help, funding their school. Or you can just donate, through our website, and just for whatever the need is.
Absolutely. The link to your website will be provided in our description. So for our viewers who are interested to learning about more about this cause and how to help and how Beyond Fistula is improving the lives of young women in Africa, you're more than welcome to click the link in the description. Thank you so much, Deborah. It was my pleasure to get to know you and the work that you're doing with Beyond Fistula.
Well, thank you. I really appreciate the time and like the passion that you have for, interviewing me and asking me questions, and your interest. I really, really appreciate you.
Wonderful. For you listening, if you liked our conversation, please press subscribe button either on YouTube or your podcast app, because this will show the algorithm that this conversation is important, so more people can learn about it and more people can take action towards helping those in need.